So today we're going to talk about our muscle relaxants, specifically succinylcholine, cisatracurium, also called Nimbex, vecuronium, norcuron, and rocuronium, also called Zemuron. We're going to talk about the main metabolism pathways for these drugs, renal elimination, and biliary elimination as well. So first we look at succinylcholine. It is a depolarizing muscle relaxant. Its metabolism is mainly 98 to 99% pseudocholinesterase. Okay. Also, pseudocholinesterase is also plasma cholinesterase and butyl cholinesterase as well. Renal elimination, very little, less than 2%, if our patient does not have a pseudocholinesterase deficiency. If no pseudo, I'll abbreviate, well, yeah, I'll get pseudo in there. Cholinesterase is my abbreviation. Deficiency. Biliary elimination is zero, none. Cisatracurium, also called Nimbex, that is a benzyl isoquinoline, non-depolarizing muscle relaxant. Nimbex is a good drug. It's organ independent. So we have about 70 to 90% Hoffman elimination, and also pseudocholinesterase elimination, ELIM for short. So if you're looking at cisatracurium and atracurium, you would see that atracurium has a higher percentage of the drug being eliminated via pseudocholinesterase elimination. So our renal elimination for cisatracurium is really low. It's about 10 to 30%. And the main metabolite there is called laudanosine. And we're going to have pretty much no biliary elimination. So if we have a patient who is normothermic and has a normal pH, this would be an amazing drug if they had liver failure and renal failure, because you will see that the elimination is pretty much organ independent. But the problem with Nimbex, cisatracurium, or benzyl isoquinoline, is the fact that these patients do have to have a normal temperature and a normal pH. Vecuronium, let's look at vecuronium. It is a steroidal monoquaternary non-depolarizer. It is metabolized hepatically 30 to 40%. Its renal elimination is going to be around 40%. Mainly metabolites. Metab-OLs, we'll call that metabolites. And then biliary elimination will be 10 to 20%. Biliary elimination. Last drug we're going to talk about is rocuronium, also called Zemuron. It's also a non-depolarizer, steroidal structure to the molecule, monoquaternary. You have minimal hepatic elimination. You have around 30 to 40%. 40%. And you'll have around 60% of biliary elimination. So, in our patients with hepatic failure, would rocuronium be the drug of choice to use if you couldn't use cisatracurium? Because that's the easy one, right? And it would be, because you have minimal hepatic clearance. 30 to 40% will be eliminated and metabolized from the kidney, and your 60% biliary elimination. So if you have kidney failure, which would be the best to use? I would have to say vecuronium, because you have 30 to 40% metabolism in your liver, and you have 40% renally. So if you have kidney failure, vecuronium would be the best to use out of these two drugs.